Welcome everyone to Greeley's Healthcare Podcast today, August 18th, 2020, discussing CMS's Memorandum on Survey Prioritization, which tells us what to expect as CMS begins to deploy back into the field. My name is Lisa Eddy. I'm the Vice President of Compliance Services with the Greeley Company, and I have here with me today Bud Pate, who is Greeley's Director of Content and Learning. And as a former bureaucrat, I thought I'd pick Bud's brain for all of us today, sort of to find out really what CMS is trying to tell us in this memo. So first off, can you tell our listeners about this memo from a broad brush standpoint?
Sure, thanks, Lisa. This memo is from a website that the CMS maintains to communicate with the 50 or so state agencies it has to do its inspection across the country. And you can see here the nature of it. It is a Center for Clinical Standards and Quality Safety and Oversight Group. That's QSO for short, and it's QSO 2035, and it pertains to all facility or provider types. In order to get to this and any other such memo, I'm going to show you here briefly how to do that. You go to the CMS website, and it's quite a long URL, but you can search for this string right here once you get onto the CMS website, policy and memos to states and regions. There we go. So if you search for that, it will come up. When you come to this page, you'll notice that it isn't really in chronological order. It starts in posting dates of 2018. Actually, excuse me, in 2011. So it starts way back in 2011. And what we clearly want to do is get to the most recent postings. So just click on this once, and then that will bring you back to the very beginning, which takes you back to 2008. That's not what you want. So if you click on that heading a second time, it will now bring the most recent one to the top. Enforcement cases, here we go, held during prioritization period and revised survey prioritization. So that's the name of the memo that we're going to be talking about, and that's how you get to it. So in broad brush, this memo redeploys the state agencies to the field. They've been out of the field since March, at least on behalf of CMS. And the reason for that, of course, is that the state agencies have had they've been coping with the pandemic. And although they may still be coping with the pandemic in some parts of the country, in those parts of the country where they're not really impacted, if they're following the White House guidelines for reopening. In other words, there's been a 2-week or 14-day trend in a decrease in the number of cases, decrease in the number of infections, decrease in those sorts of things. And you need to refer to the White House, not the CDC guidelines, but the White House guidelines, which are actually different than CDC guidelines. But according to CMS, once it reopens according to those guidelines, then the state agency needs to redeploy into the field. So that's essentially what it says, and it goes on for many, many pages, well, 9 pages to be specific, describing exactly what that means to reopen.
So as we look at that, Bud, it covers a lot of the different healthcare entities, but we're going to talk a little bit about perhaps the acute care hospitals and critical access hospitals. And if you could show, there we go, the non-long-term care, perfect, the expanded survey activities. And here's sort of the prioritization and how they will deploy back into the field. If you want to talk about that a little bit, I'd appreciate that.
Sure. Before I do, I'm just going to tell you that the other parts, this first part, and if you're looking at this yourself, don't get confused. As Lisa said, we're really concerned with the non-long-term care folks, because in the long-term care industry, the whole enforcement scheme is different. And so these terms won't mean a lot to hospitals, critical access hospitals, ambulatory surgical centers, et cetera. So part one just deals with nursing homes, essentially. And then as we go down here on the, if I can find it again, here's the non-long-term care guidance. There's a third section that deals with labs, and so we're not going to talk about that. So again, the acute care facilities and provider types, here is the priority. So they're to do revisits or surveys, or they're going to do revisit surveys for past non-compliance that do not otherwise qualify for desk review. So what is desk review? Desk review means that in lieu of a revisit, and they would prefer that you do a desk review than a revisit if you're a state agency. In order to qualify for a revisit, the nature of the finding or the deficiency must be amenable to the provision of proof by the provider. So in other words, if you get a 20-page statement of deficiencies and you can submit evidence of compliance to the state agency may be able to just check off without actually coming back out to the facility. Now that assumes that any sort of immediate jeopardy finding has been abated by an on-site review. But once immediate jeopardy is off the table, then you could theoretically go through a desk review by the state agency. But if you can't do a desk review, then the revisits for outstanding enforcement actions is the first priority. The second priority is complaint surveys triggered as non-IJ level or higher that have not been completed. So even in March, if there was an IJ, meaning immediate jeopardy, if there was a complaint that alleged immediate jeopardy, there was no hiatus. The state agency was to go out there and validate that the jeopardy situation existed, and if they did validate it, they were to stay engaged until the jeopardy was abated. So, complaint surveys triaged as a non-IJ level have been completed. So you need to do those surveys. So there might be a backlog of complaints that didn't allege an IJ. Then special purpose renal dialysis facility surveys are next. Initial surveys for new providers to keep that supply chain going. Past due recertification of two kinds. But what do we mean by recertification survey? Let's talk about that term. So number 5 and number 6. First thing is a recertification survey is what we think of as a routine, or in the case of Joint Commission accredited hospitals, a triennial survey. And thinking about hospitals that are accredited by the Joint Commission, the state agency does not do recertification surveys. It actually only does for cause or validation surveys. So they wouldn't have, so if a hospital or a critical access hospital or an ambulatory surgical center were accredited, then this would not even be on their plate. So they wouldn't need to do that. That would be on the accrediting organization's plate. And we've talked elsewhere about how the Joint Commission and other accreditors are resuming the field. But assuming that the provider is not accredited, then the state agency is behooved to go back every once in a while. They go out, they do a survey, they resolve all the issues, they do a follow-up survey or a desk review, and all deficiencies are corrected. And then they just lie dormant, and although they might investigate complaints, they do another full survey until that recertification period comes up. And hospitals do not have a statutorily required survey interval. There are recertification intervals, I believe, in the state operations manual, but some provider types have a statutorily required survey interval. So that's what that means. I don't want to get too deep into the weeds. The bottom line is they're coming, the state agencies, assuming that the local area is suitable for state agency involvement in the field, and they pass the White House criteria for reopening, then they're back in the field. And this is not a new sequence. This is revitalizing the old priority list as to what to do first, second, third, fourth, fifth, and sixth.
Thank you for that, Bud. I appreciate it. I do want to point out, if you go back up a little bit in that document there, Bud, right in the middle, stop. It says during the period of COVID-19, the public health emergency, the surveyor should continue to use the COVID-19 focused infection control survey. I was actually had the pleasure of being on site at a facility that had a visit from the state agency, and they absolutely follow that. Just so everybody is aware, they follow that focused infection control survey very, very closely, and there will be look-sees to see how organizations are managing COVID and what those particular, how the criteria is being followed and so forth. So just be aware of that. The other thing, but I talked to Bud about this earlier, and just, Bud being a bureaucrat and being over the Los Angeles County Department of CDPH, California, for 15 years. So I said to Bud, what happens if state agencies differ from the White House criteria? So you have some states that are maybe perhaps don't feel that comfortable with their surveyors going back in the field. Some state agencies may not. Bud's response. Bud, you want to just talk about that for a second?
Sure. I mean, since different states have different opening criteria, and whatever is the more stringent opening criteria is what they're going to follow. So even if CMS is telling the state agency to go out and do a survey, but the state is saying, no, you shouldn't do it, they're not going to go out. And I think this is a short-term misalignment. Hopefully by the time the pandemic is done, everybody will be open and it won't be a big deal. But right now, because of the nature of the opening criteria, the White House criteria being different than CDC criteria, and both of those sometimes being different than the state criteria, there will be situations where the White House says it's okay to open, where the state says it's not. Well, yeah. Guess what? The higher, more restrictive a set of laws, rules, and regulations would apply, and the state surveyors would not really deploy in that situation. I am, by the way, I brought up, you'll see in the part that Lisa was talking about here, there is a link, and it's QSO 2020 all, and I just happened to click on the link, and here we are. Here is the focused review, and you see that there's a focused review for nursing homes, just like this memo. It looks at nursing homes first, and you really have to get quite down into the document. So here's for acute and continuing care, and this is what Lisa's talking about. They're looking at hand hygiene, use of PPE, transmission-based precautions, standards, policies and procedures, infection surveillance, education monitoring, screening of staff. So it's not a brief survey by any stretch of the imagination. And so, Lisa, from what you're saying is based on your experience, they really go down this. Do you have any guesstimate as to how much time it would take a surveyor on a routine survey to do this sort of thing?
Well, I can just go by my experience. My experience was, as the survey was being conducted, there were components of the survey that included, just by natural surveillance and observations and touring, that were conducted. But there's a component of the survey that's dedicated to looking at documentation of preparation for COVID, management of COVID, what the hospital's doing, and then there's also interview of staff, and they would go to very close attention is paid on whether when people are entering and exiting the building, whether you're really doing the COVID testing as you're asking the criteria questions that the hospital has set up, whatever their particular criteria is. They're looking to see if you're following what the CDC recommends. They're looking to see if you're following this particular document that Bud just showed you. I can't really give you a time frame, but because the experience that I had was during it was a visit for something else, and this was conducted while they were doing some of the other review, and also they did some of this because it's not, some of it's standalone question and answer and review. But another question that I had that I know that people are curious about in relationship to this memo is the expanded desk review. If you can scroll on down to that part of the non-long-term care.
So there's a desk review part. There's desk review part in the long-term care. So in order to look at the right, unless you're a nursing home, you need to go to section 2, which begins on page 7, and go on down. At the bottom of page 7 is where the heading expanded desk review goes on. Now in this, so there's a couple of points here that restarts the clock. So essentially, as of the date of this letter, there are 10 days for outstanding outstanding statements of deficiencies where a POC was not submitted to now actually submit a live POC. So by the 27th of August, if your facility happened to have a statement of deficiencies and due to the emergency, they said, never mind, we're not really reviewing plans of correction. There's no immediate jeopardy involved here. We'll let you know when to submit the plan of correction. Well, now is the time. So those need to be submitted. Each state will do their own notification, but in general, the rules they're trying to follow is that they have all those plans of correction submitted by the 27th of August. And then the state surveyor, when they get the plan of correction, if, and preferably, but again, there's going to be variation based on the local office, but CMS would prefer that in addition to the plan to correct, evidence was submitted. Now, that oftentimes is, the equivalent of binders full of material. In the old days, it was binders. Now it's just a huge PDF file. So, but before you go to the trouble of creating a huge PDF file that shows policies and evidence of training and, rosters of attendance and things like that show evidence that the surveyor can look at from their desk and see, yes, they've implemented the plan of correction. Before you do that, I would check with the local office as to whether they want that. But the CMS now allows them to consider that information and theoretically clear the entire deficiency statement just on a review of the evidence submitted by the facility. So that would be above and beyond the plan of correction. State surveyors can perform desk reviews, and that's what a desk review is, for all open surveys, meaning the things that have not been followed up on, that cited any level of noncompliance, including noncompliance that was cited at the IJ level, where the IJ finding has been abated, essentially. So even though there was an IJ involved in the original impetus for the survey, as long as that's been abated, then they can do a desk review for even the issue that was the subject of the IJ, as long as it's no longer at the jeopardy level. And so this goes back, it says beginning June 1, and as we speak, it's August 18th. And so on-site reviews are authorized and should resume as appropriate. So essentially what they're saying is, go get them, folks.
Yeah. So there is one thing I want to just emphasize that Bud said, I think is very important for our listeners. If you have to submit a plan of correction because for a desk review, you do want to contact that state agency. You do want to find out from them, the people that are going to be requesting the information and reviewing it, exactly what they want in terms of evidence, because otherwise you're going to be sending all kinds of stuff that maybe you don't need to send. So that was very good insight, Bud. I appreciate that. I think our listeners do too.
Yeah, because remember that The state agency also represents the state of California, state of Texas, state of Florida, state of New York, state of Ohio. And the rules for following up with state citations may be different than CMS.
Right.
So they and some state agency might say, never mind sending it in, just have it ready. We'll be out on a follow-up unannounced, and we'll review it when we're out there. Or alternative, they may say, yeah, please submit it. If they do say please submit it, I suggest to you that you impose on their time for a 15-minute conversation to just go over, this is what I was thinking of submitting.
Yes.
And go through that with the surveyor so that you don't, because a lot of times there are things that they want that you wouldn't have predicted. And even more of the time, there are things that you think they would want that they really don't want to see. So that's just a word to the wise.
Yep, I agree. So anything else, Bud, you want to share with our listeners about this? It pretty much tells us that they're back deploying into the field, and we need to be ready for that. Anything else?
Yeah, and this is the only thing is that the Joint Commission is also back in the field, as are other accrediting agencies, and that has actually happened. But when we say back to the field, I just want everybody to know that as of late July, so as of a few weeks ago, the Joint Commission was really back only in about 10% of the communities across the country, because they're following the CDC guidelines for reopening, unlike CMS, which is following the White House guidelines, which are different. And so, so even though they're back in the field, it all presumes that there's been essentially a 2-week downward trend in the COVID profile, whether you're looking at new cases, prevalence of the infection, hospitalizations, deaths, whatever it is you're looking at. It depends on the criteria they're using. But in Joint Commission's case, they were only able to actually schedule on-site surveys in about 10% of the country. And that's, I don't know, we're going to learn tomorrow, I guess, Lisa, whether the profile has changed a little bit in the last couple of weeks, whether it's going up or down. But when I say they're back in the field, they're back in the field, both Joint Commission and CMS and the state agencies, as local conditions allow. Okay, well, thank you very much, Bud. And I want to thank our listeners for joining us for Greeley's Healthcare Podcast. You feel free, everybody can feel free to go to Greeley's website, that's greeley.com, to get other helpful information and tips and various documents and so forth related to COVID, CMS, and regulatory compliance. So with that, we'll say thank you so much for listening and have a good rest of your day.